Let's kick things off with rather some surprising findings. Which was the biggest surprise for you?
So I think the biggest surprise probably is around the positivity around people's work and home life. A lot of our respondents have indicated that while they are worried about their finances, they are surprisingly feeling really positive about their work and family situation, possibly because of the flexible working arrangements that have been put in place since the onset of COVID.
It surprised me that people were more happy with it. It didn't actually feel as isolated as well as many would have naturally assumed, with lockdowns prevalent in large parts of the world.
Yeah, no, that's correct. So we have also seen a decrease in feelings of loneliness. A lot of our participants have said that actually their interpersonal relationships have improved, all of which are pretty surprising. And interestingly, it is the markets that have experienced the toughest lockdowns, like the UK, Spain, and the UAE, that have shown the greatest improvements in a lot of the trends here. So it's not all bad news. So that's been really positive.
Yeah, and the other thing is that, can you tell us about Always On? Because these days you use your phone, you're always in contact with the office, and times of working from home, that's probably even more the case. Tell us about how that has played into this.
Yeah, so well, we've been doing this survey for sort of over 6 years now, and every year the Always On culture has been there. And today, with flexible working situations becoming more prevalent, people are reporting that flexible working doesn't necessarily mean less working. In fact, most of them are working far more longer hours than they would if they were in the office. But the good news is, I think because we are now better able to manage our day, it's a lot more flexible how we want to plan it. People are reporting better job satisfaction despite having to work longer hours. A couple of reasons cited include just the ability to be home and to look after their partners and families, but also improved communications with colleagues, whether remotely or on video conferencing or via calls. And so all of that is good news. That said, I would still encourage employers to be mindful that during this period, providing adequate mental health support is important, because physically being distant from colleagues and people you normally come into contact with can be difficult. Some individuals are also better set up for home working than others. And so when it comes to evaluating how long flexible working could go on for, it's important to remember that we're all different and that different employees will require sort of different support to enable them to be productive during this period.
To that point, Dawn, when you take a look at virtual health, have attitudes changed both for the employers as well as the employees?
Yes. So digital health, including telehealth, so virtual consultations with doctors and psychologists, is something we have been pushing for the last couple of years. But I think COVID has really accelerated the adoption of a lot of these technologies. We have seen from the survey that the majority of individuals across markets are a lot more willing to try out virtual consultations today than they would in place of traditional face-to-face consultations. Internally within Cigna, our global telehealth utilization rates have gone up 6-fold since the beginning of COVID. And so we think this is a permanent shift in a consumer's attitude towards digital health, and that it will stay, and which will obviously influence the way we evaluate how we finance healthcare solutions moving forward. But it's all positive. At the end of the day, we want to make sure individuals get access, whether it's for generic health support, for drug deliveries, or for mental health support. These are the sort of top 3 reasons why individuals are a lot more keen to use virtual solutions today versus traditional methods of access.
We talk about the new normal, Dawn. What are the expectations of this new normal?
Yeah, it's gonna, I think, mean different things to different people. But I think from the onset, I think working routines will change. Today, individuals who don't normally work from home have been forced to. And given how long and this may potentially go on for, we may see employers putting flexible working arrangements as a sort of ongoing arrangement as opposed to one that is temporary. So I think you're starting to see some of that shift. I think the greatest sort of difference we're going to see is perhaps in healthcare trends. So digital health has received a great boost from COVID. Virtual consultations with GPs, specialists, organizing for drug deliveries, seeing your physio, your psychologist online is going to become a lot more normal than it was pre-COVID. And all of this will be here to stay. And with that, I think as insurers, we will need to look at how we provide benefits and coverage for our customers. Employers will need to ensure that they provide the right collaboration and communication tools for employees to work effectively from home, but also to figure out how they would provide a lot of the mental health or workplace support that they normally do on-site,
Dawn,
remotely.
Dawn, for insurers like Cigna, what are some of the services that are now being considered?
Yeah, so we have always provided customers with the ability to visit their doctors remotely, and we provide coverage for that. Today, that doesn't change, but we're looking at expanding the scope to include not just general practitioners, but also specialists, allied healthcare professionals like physiotherapists, psychologists. In some markets today, we are already providing our customers with drug delivery services. We are extending their supplies of medication to ensure they continue to get access during this period. But more generally, we're also looking at how we can adjust our offering to enable employers to support their employees virtually. So putting online a lot of the offline and in-person services that we already provide today.
Dawn, I just want to pick up on that whole thing about the new normal with just, I think, 13% of all people believing that life will never be the same again. Do you think there's a change in employers, I should say, as well, with regard to what's happened before and how much more they're comfortable with the way things have gone in the last few months?
Yeah, I think what I would say to that is we are all learning and we are all trying to figure out what works. I think previously, because of COVID, actually ongoing, employers have had to make certain adjustments to the way we work, to the way we interact, and some have adjusted more than others. And I think moving forward, all employers and ourselves really are looking at what really is the most effective and productive way for people to continue doing the work that they do. And if we have the right infrastructure, the right culture in place that will enable us to perform. So I think we are really still in early days. Most employers, I think, have been pretty, surprisingly been pretty sort of confident at their employees being able to do the work they need to do even remotely. And I think employees have adjusted. I think from what we've seen in our survey, most of us are pretty resilient, and we have leveraged technology to help us connect with friends, family, and fellow co-workers. So I think in the coming months, we will see more changes and people adapting in new ways. But I do think a lot of the trends that we see today will stay post-COVID.